Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Hormonal study and ultrasonography. On hormonal study, if you do serum progesterone in a female who is ovulating, or if progesterone is predominant in them, the serum progesterone is more, that is more than or equal to 3 nanogram per ml. If the female is not ovulating, that is estrogen is predominant, then serum progesterone will be less than 3 nanogram per ml. Luteinizing hormone kits. Luteinizing hormone kits will test positive in 24 hours. That is, if they test positive in within 24 hours, then it is ovulation. Fertilizable span of ova. Fertilizable span of ova is approximately equals to 24 hours. So one can have intercourse up to 48 hours uh, so that they can get pregnant. The best test to detect ovulation is hormonal study. Hormonal study and ultrasonography. On
thank you and thank you for watching.